Hello, Ms. Martinez.
Hi.
I'm Kelly. Nice to meet you.
Nice to meet you.
I'm going to be your diabetic educator. I understand Dr. Smith sent you for diabetic education. Is that correct?
Yes, that is correct.
Do you understand what diabetes mellitus is?
No, I don't. Will you please tell me?
Sure. Diabetes, according to Healthy People 2020, results from a combination of resistance to the action of insulin and insufficient insulin production. Diabetes occurs when the body cannot produce enough insulin or cannot respond appropriate to insulin. Insulin is a hormone that the body needs to absorb and use glucose as fuel for the body's cells. Without proper function of insulin, blood glucose levels become elevated and other metabolic abnormalities occur, leading to the development of serious and disabling complications. Once hyperglycemia or high blood sugar results, it can lead to polyuria, which is where you urinate a lot, excessive thirst, or ketones in the urine, along with weight loss. I want you to know that you are not alone in this diagnosis. 29.1 million people in the United States have been diagnosed and is the 7th leading cause of death. Diabetes increases the risk of heart attack and is the leading cause of kidney failure, lower limb amputations, and adult onset blindness. Other risk includes cognitive impairment, incontinence, fractures, and cancer risk, along with neuropathy. Mexican Americans and Puerto Ricans are twice as likely to have this disease as non-Hispanic whites.
Can I do anything to help my blood sugar improve or reverse my diabetes?
Lifestyle modifications, which includes diet and exercise, will help you. Eating a low-carb diet, low sugar intake, along with healthy protein snacks. Steer away from carbohydrates like potatoes, rice, tortillas, and chips. Another simple saying is, if it's light, stay away at night. Limit foods and beverages high in saturated fats, sugars, and sodium. Protein foods like seafood, lean meats, poultry, eggs, legumes like beans and peas, nuts, seeds, and soy are an appropriate option. Walking daily for 30 minutes per day, 5 days a week, should be combined with a low-fat diet. Your doctor will most likely draw a periodic laboratory result called a hemoglobin A1C. This monitors your blood glucose over 2 to 3 months. You will also need your eyes checked and fit exams to evaluate for vascular damage. You may be given a glucose monitor or a glucometer that will be used for measuring your day-to-day monitoring. It looks like this. You will prick your finger and provide a small blood sample. The glucometer will measure your glucose for that specific time. If you do not have a glucometer, one fancy saying is, if you're cold and clammy, you need some candy. Hot and dry, your sugar is high. Dr. Smith's medication regimen for you includes the use of metformin. Metformin inhibits glucose production in the liver. It reduces your glucose absorption in the gut and sensitizes insulin receptors in target tissues. Metformin does not drop your blood glucose, therefore you can skip a meal and be safe. The most common side effect of metformin is GI upset, like nausea, vomiting, and diarrhea.
Do I have to take an insulin shot?
Good question. At this time, lifestyle modification and metformin is your only regimen to control your diabetes. If this regimen does not obtain adequate glucose control, Dr. Smith may add a second oral medication. If in 3 to 6 months the drug combination and lifestyle modification fails, Dr. Smith may consider adding insulin to your regimen, which we will cover at a later date if that time comes. Dr. Smith may consider consulting an endocrinologist to better care for your diabetic and insulin management. Once you start your regimen, you need to monitor your hypoglycemia or low blood sugar. This is a glucose reading below 70. Symptoms include a mild headache, confusion, drowsiness, and fatigue. If severe, it can lead to convulsions, coma, and possible death. If you are conscious, give a fast-acting oral sugar supplement like orange juice, honey, syrup, a non-diet soda, and people with diabetes should always have an oral carbohydrate like a sugar candy, Jolly Ranchers, peppermints. Lastly, I know we covered a lot of information, but I am sending you with these handouts for a healthy diet and exercise tips. Information guide over your new medication and after hours number that you can contact if you have any questions or concerns. Also attached is my office number and the websites to use in case you have any questions or concerns after hours. Any questions right now?
No, I think you covered everything. I feel completely prepared to manage my diabetes.
Thank you, Ms. Martinez. Take care.